All right, Chris Popper here, Bangor. I'm joined by Chrissi Maguire, the CEO and president of MDI Hospital, Mariah Cormier with MDI Hospital as well. And Chrissi, you're wearing blue today. You've got the blue
Yeah,
shirt, you got the blue glasses. I have blue
and
on.
all blue.
Tell us why we're all wearing blue today.
Well, we're wearing blue today to draw attention to the importance of colorectal health and having screenings for colorectal health. 150,000 individuals in the United States are at risk right now because they are not screened. And screening for colorectal health actually can improve the survival rate of every individual by 90%. It is, and I will be the first one to tell you, it is typically not what you want to talk about is colorectal health, but it is incredibly important. It's just as important as breast health and mammography. And I was one of those individuals who was like, oh, wow, I don't know, I'm not sure, but I am the first one to tell you that having a colonoscopy is non-invasive. It is important screening that, I thought I'd be on the 10-year plan, but I'm on the 3-year plan. And I am so grateful that I had my screening. And the care that I received at MDI Hospital was phenomenal. The information and how important it was to know what my health journey might look like in the future. I was able now to make sure that my children and my family, my sisters, understand the importance of what we had actually had no risk in our family, but having a colonoscopy and talking to your provider about the importance of preventative care and screenings, it saves lives. And for us, the reason we're wearing blue today is because our commitment is always about vibrancy, health, and saving lives. And if a shout out helps someone think about it, and if my saying, listen, I understand it was something like, oh, let's talk about that later. This is important. You need to do your screening. You need to know if you are at risk and if you might have a diagnosis that is preventable and curable. So we are absolutely advocating for colorectal health today.
All right, and also it's a day to honor a group of employees at MDI Hospital, the Hospitalists. And I mean, many people don't know what a hospitalist does.
No. So, and you're absolutely right. We actually started a program at MDI Hospital, Chris, that every hospitalist has their own card, which gives patients an idea of what the hospitalists do and who they are as their provider. So the hospitalist program, and most hospitals have evolved to this. In the days before Mariah, Chris, let's just say before Mariah, you had a primary care doctor, and if you had to go to the hospital, they admitted you and they rounded on you. And that really was hard to keep a stable practice going of taking care of patients if the primary care doctor was always in the hospital. So the evolution was to have physicians, primarily internists, internal medicine providers, actually take over the inpatient and admissions at a hospital, and that's what MDI Hospital has. And this is celebrating our hospitalists and our hospitalist program. They have such a deep commitment towards service, and they want to make sure that all of our patients who are admitted at MDI or understand the program, but also are cared for by highly skilled internists who can manage their care, want to make sure that they are discharged appropriately, that they have all the information they have, and that builds a connection between what we call our primary care spokes. So our internists are talking to the primary care physicians about the patients every day. Our care management team and case management team are working with the care teams in those practices to make sure there is warm handoffs, that there's transitional care, and that's transformational care as well. So our hospitalist program is staffed 24/7, 365. And there is usually a physician as well as a physician's assistant to make sure that the care is managed appropriately, but also that the patients are well cared for and informed. And that includes the family. We want to make sure when we are taking care of our patients, we consider the entire community, and the family is part of that community and part of the care team. Ultimately, if you have a family member who is hospitalized, it's a scary place to be a hospital, and we want to make sure that they're well cared for and making sure the family understands how best to care for their loved one as well. So it's a shout out for our hospitalist team. They often are kind of behind the scenes. Unless you're admitted to the hospital, you really don't have an introduction to them, but they are a backbone of how we're able to manage our amazing primary care practices, but also ensure to the community that we can take care of you close to home. You don't have to go and be admitted at another large hospital where you can stay close to home on the island.
Well, talking about taking care of the community close to home, you can't do it without money. And one of the big things that's happening right now is the supplemental budget. And that has a major effect, not only on MDI hospital, but on all the hospitals. And I mean, you were and I'm not sure how long ago, but you were in charge of the Maine Hospital Association, correct? Still are. So okay. So I mean, you know firsthand not only how this is impacting MDI hospital, but all the hospitals throughout the state.
And other healthcare providers, Chris.
Right. Nursing homes.
Right.
Yes.
Nursing home. FQHCs, Bucksport, Regional, Penobscot Community, Lubec, Eastport, all of these healthcare providers are impacted by these decisions. And MDI is in the crosshairs of the supplemental budget, and really working to explain to our delegation and our representatives that the impact of this impasse has on hospitals. And as the chair of the Maine Hospital Association, I do have a broader lens on how this impacts both our large tertiary centers, such as Eastern Maine Medical Center and Maine Medical Center in Portland. It's a huge deficit to go without payments. And more importantly, we want to advocate for a reasonable solution.
One of the things, just so everybody knows, one of the things that the state is saying is that they're going to have to hold back on reimbursements unless the supplemental budget is passed.
Right. So what the state is going to do effective March 12th is critical access hospitals. So MDI hospital is a critical access hospital. And I underscore independence. So we're not aligned with a system. We're not a Northern Light Hospital. We're not a Maine Health or Covenant or Central Maine. So we are independent. And critical access hospitals receive an interim payment each week. And we're going to take a 30% haircut effective next Wednesday. That's a big number for a small hospital that doesn't have a system to rely on it. But it's a big number for the systems as well, because every claim that a big system has that's over $50,000 is just not even going to be processed. So to think that there is a deficit in our supplemental budget, which gets us to the end of this the state fiscal year, which is June 30th.
Right.
It's $118 million deficit, primarily in the Maine Care or Medicaid bucket. And the hospitals, again, are going to have to go at risk and leverage the state's budget in order for it to get to deal with the biennial budget. Now, if there isn't, and I will tell you, Chris, I don't see a pathway that this is going to get the 2/3 majority necessary to pass next week, then it will pass.
For emergency passes, so it can go immediately.
Right. Okay. So if not, it will be passed. but it won't go into effect till 90 days after adjournment. And if the legislature goes well past into the summer, we are not going, and each week they're going to cut the payment even more until the end of the state's fiscal year. That is just detrimental. We just really need some advocacy here, and we need help in framing the discussion and asking our representatives to come together and find some common ground, because we haven't even talked about the biennial budget, which has $50 million of structural deficits that need to be dealt with. So informing the general public, helping them understand, I want to be perfectly clear. MDI Hospital is going to see every single patient that walks through our health centers and our doors, uninterrupted. But if it lingers into next fall, and we again are talking about building huge amounts of payables due to hospitals, in 2016, that was over $500 million owed to hospitals. That's going to be well over $1 billion owed to hospitals. We need to fix this problem, and we need to bring awareness to it, because hospitals aren't causing this issue. We're taking care of patients, and much of this money that's due to us is for services that we already gave. So it's not that, oh, we're just going to stop paying you because of the services that you're going to render. This is money due on services that we already have rendered. And again, I want all of your listeners to know we are going to be open for business. We're going to continue to see patients. It's about the future of how we're going to have to be able to provide services down the road.
Right. And I mean, and we've all heard about, and this has nothing to do with MDI Hospital, but of labor and delivery services being cut throughout the state, bond ratings being reduced at various hospitals throughout the state. When the state doesn't come through with their commitment and pay what's owed, this just exacerbates the problems.
It exacerbates it. And to be fair, Chris, MDI Hospital doesn't deliver a lot of babies like we used to. So you're right. All of these things are further things that we have to advance discussions and figure out what does that new realities look like, and how do we care for it with our small bucket of money that we have. But we will continue to serve this community. We are deeply dedicated. This community is so responsive to this hospital. Their commitment to us is the secret sauce of why we are successful. This community, our patients, our families, our loved ones, and our team members, they're the secret sauce as to why MDI Hospital will remain for the next 130 years offering services to this great community. But these are tough times, and we're going to have to make some tough decisions in order to balance our own budget. Our fiscal year runs May 1st through April 30th. So we're in the middle of budgeting right now, and we're like, okay, what are we going to be able to do? How are we going to be able to grow? And oftentimes I'm asked, well, you're doing this major expansion. I said that major expansion is key for the success and the future of this organization. We can't not continue to be strategic and grow in troubled times. We have to figure out how we do, and again, the success of how we're going to be able to do this expansion is because we've had so much support from the community in way of donations and grants and funding. But we're going to have to make critical decisions about the next 2 years of operational funding and what that might look like for the future.
So for the people who are watching this, listening to this, what they basically need to do is to contact their state reps, their state senator. And again, this is the state budget.
It's the state budget. It's the state budget. We don't have enough time for the federal, but the state budget. The immediate need right now is just to really to to help representatives understand and help them give you their feedback on why we're not going to why we're not going to be able to get this passed in emergency passage, because to your point, Chris, if it's passed by the 2/3 vote, then there's no interruption. The funding is done, and I absolutely know we have to do work on the biennial. I absolutely know, all of us, every single Mainer needs to figure out what and how we can survive and manage a budget and offer the services, the key and vital services we need. But to put the hospitals and the health centers and the federally qualified health centers and rural health clinics at risk again is just, it's too impactful for us not to have a voice in.
All right. Well, obviously, listeners and viewers can do their part. Contact your state rep, contact your state senator. And, you know, if people would only get around a table and talk, these things probably could be solved. And, you know, it's just, nobody wants late night deals, but you got to get to the table and have these conversations, because at this point, there's just far too much at risk.
There absolutely is. And bipartisanship is the only way we're going to be able to do this. We're going to, in negotiations, and we all know in negotiations, everybody gives a little. And right now we have to get to the point that we're willing to even talk about what we're willing to even negotiate on.
Right.
So that's the important conversation. And I know that your local representatives are more than willing to hear from you about the importance and where their positions are and how you can help guide them about what's important for you. We are their constituents, and they want and they need the leadership and guidance from the voices that elected them. So I do encourage them. And I have posted an op-ed. That certainly is available. We'll make it available on our website. It has the links to representatives, so you can get a quick link to not only your local representatives, but the minority and majority in both House and Senate. And we just appreciate you taking the time, Chris, to help us navigate these uncharted waters, or rather, I think we're charting them again, and find a healthy solution for the future.
All right, Chrissi, thanks so much. We look forward to hopefully getting a solution about this, and we love to talk to you again about the expansions and all things happening down on the island at MDI Hospital.
Absolutely. We're looking forward to it. We just received the town's approval to move the project forward, and which is a major milestone for us. So we're excited about our bold, bright future of Mount Desert Island Hospital.
All right. Thanks so much. Have a good weekend.
Okay. Thank you. You too.